Hello, I'm Vandana Siew Sankar-Ali, Clinical Psychologist, and I'm so pleased to once again join with Sir Optimist International Chaguanas Club as we commemorate Mental Health Awareness Month, which is observed around the world during the month of May. Today we'll be talking about loneliness and depression, as loneliness has been recognized by some countries as the theme for this month's mental health awareness. What is depression? Depression is a serious and pervasive mood disorder which manifests itself as sadness, helplessness, hopelessness, apathy, and many more significant symptoms. It can be mild, moderate, or severe, and it causes disruption in a person's life. Now, this is such an important issue as it relates to women because women from after the age of puberty are twice more likely than men to develop depression. And 1 in every 4 women around the world have experienced major depression at some point in their life. That's 25% of the world's population of women experience depression. So this is a very serious issue which must be addressed. Now, let's talk about how is depression specific to women? How does it manifest specifically for women? Well, first of all, depression tends to manifest in a way that is highly influenced by women's hormones. So we would see that there are times at a woman's life that depression is more likely. There is premenstrual dysphoric disorder, which happens around the period of time surrounding a woman's menstrual cycle. So this is just about the time when a woman is menstruating. Women may typically experience this, which is associated with premenstrual syndrome. There is also perinatal depression, which is depression that occurs in pregnancy, and this is also associated with postpartum depression, which is depression that occurs in the aftermath of childbirth. There is also perimenopausal depression, which is depression that occurs as a result of the hormonal changes around the time of menopause. Women's depression also tends to manifest a bit earlier, last longer, and may also reoccur during life. It may also be associated with stressful life events for a woman. Depression in women also tends to be associated with much more guilt and suicidal attempts, though women may be less likely to actually execute and take their own lives compared to men. Depression in women also tends to occur or be comorbid with other mental health disorders such as anxiety, panic disorders, and phobias. So, what are the risk factors for being diagnosed or experiencing depression? Well, if you've had a family or personal history of other mood disorders, that's a risk factor. Also, experiencing adverse childhood events such as abuse or maltreatment. Depression may also be a side effect of certain medication and may also result because of excessive drug or alcohol abuse. Another risk factor for depression involves ongoing psychological and social stress emanating from relationship challenges, marital distress, job losses, difficulties within the family circle, as well as loss of a person's social support circle and that connection of persons that help them to feel grounded and to be able to cope. So, how can one recognize if a person is experiencing depression? What are the symptoms of depression? There are several. Firstly, low mood or depressed mood every day for most of the day. A loss of interest or a marked loss of desire and interest and pleasure in things that a person would typically enjoy every day for most of the day. Loss of concentration, difficulty keeping focus, fatigue and low energy, a reduction in a person's speed of thought or slowing down of thought and therefore slowing down of motions and movement, suicidal ideation or suicidal attempts with or without a specific plan or intent to commit the act. all of these things come together, but to get a diagnosis of depression, a person must also be experiencing challenges with their sleeping patterns, eating patterns. They may find themselves experiencing insomnia or hypersomnia, or too much sleep. They may be losing weight or putting on weight without necessarily being on a particular diet. Now, to receive a diagnosis of depression, a person must be experiencing five or more of these symptoms for at least the same 2-week period, and at least one of those symptoms must be the low mood, the depressed mood, or the loss of interest and pleasure in things previously enjoyed. The symptoms must also not be as a result of substance use or medication, and it must be having a significant impact on a person's ability to function in various areas of their life. So, as one can see, depression is real and it is very serious, and it needs to be treated as such. It is not the same as sadness, and that's often difficult to distinguish because feelings of sadness, hopelessness, worthlessness, these feelings go hand in hand with the experience of depression. But persons who are sad may feel sad for a brief period of time, and then they feel better after a while. They may be linked to a specific trigger. They may still find joy and enjoyment in other things, and they may not necessarily have a significant impact on their eating and sleeping patterns. This is not the case with depression. And because of that, depression is not something that you can tell someone snap out of it or pray your way out of it. Yes, prayer is an important coping tool for many persons, but it is not the solution for a disorder as serious as depression or for mental health disorders, just as it isn't for other physical illnesses. So, how do we treat depression, therefore? Well, I'm here to tell you that depression is treatable. Firstly, you may require medication or antidepressants, but not everyone requires that. It depends on the severity of the illness, and that can be given by either your medical doctor or a psychiatrist. Depression treatment is also highly effective when it is combined with psychotherapy. And cognitive behavioral therapy has been found to be an empirically proven and evidence-based form of intervention that is highly effective for treating depression. And this involves addressing the root negative thought patterns or cognitive distortions that drive the negative emotions and the experience of depression. And so it helps to really reframe those negative thoughts into more objective, evidence-based, and positive thoughts, and therefore to change the feeling and the behavior associated with it. Psychotherapy aims not only to do that, but to also provide an opportunity to ventilate emotions and to find support and coping resources. In addition to medication and psychotherapy, some of the other conservative methods of self-care that I shared with you in my last video are also applicable in the treatment of depression. And that involves taking care of your physical health by eating well and exercising moderately, and taking care of your mental health by doing the things that relax you and make you feel good about yourself. And that involves relaxation exercise, engaging in a hobby or a leisurely activity, practicing positive self-talk, being compassionate towards yourself. Studies have also found that doing something positive for other persons also helps to treat with depression. So that experience of altruism and doing volunteer work or doing something good and having a positive influence on another person's life has been found to have healing effects. Additionally, apart from nurturing yourself, nurturing something else like a plant or a pet has also been found to be effective. So there are multiple ways that depression can be treated, but it's important that it is treated. And therefore, I'm here to share with you that you do not have to suffer alone. Depression is curable and it actually responds very well to treatment. So ladies, as I mentioned in my last video, we take care of everyone. It's time that we take care of ourselves. Until our next video, bye for now.